The healthcare in Kenya faces a significant challenge as many families struggle with the high cost of medical care. Despite ongoing efforts to improve access and affordability, majority of the population lacks health insurance. According to the 2023 Kenya Demographic and Health Survey, only 26 to 30% of Kenyans are covered by some form of medical insurance. This leaves the majority of the population vulnerable to out-of-pocket expenses, as the government is urging Kenyans to register with the new Social Health Insurance Fund through the Social Health Authority, SHA, to address these gaps. The chair of the SHA argues that a sustainable solution requires pre-financing of healthcare to ensure that financial protection is in place before medical needs arise.
I used to know it was expensive until I got into this position, and I had to do a fundraiser, like she said. And I can give you a random example. My first chemotherapy, I had to do 4 sets of treatment. My first one was chemotherapy, and the first chemo cycle was 585,000 Kenya shillings, and I had to do 6 of them. So I am a teacher. There's no way on this planet with a teacher salary you can afford that. So I had to do a fundraiser, and it's also very humbling, and it's difficult.
And there are many thoughts on whether is insurance a public or private good. Is insurance something that should be taken care of by government? Is it something that essentially should be done as universal healthcare only, or is it done by private sector? And really, the thought is, ideally, there's no way private sector can adequately provide coverage because we don't have the ability to reach everybody. There's a role for public sector, and that is a very strong social layer.
The truth of the matter is, at the beginning, especially for us as a Social Health Authority, what we want is a system where everybody can be able to get health coverage. They have got access, and they have got access to healthcare of sufficient quality to be effective, and at the component of financial risk protection, so they shouldn't have financial hardship at the point of accessing care.